Hello, and thank you for downloading NATO's Beacon Communities Program podcast series. The Beacon Communities Program is a grant program for communities to build and strengthen their health information technology infrastructure and exchange capabilities. These communities will demonstrate the vision of a future where hospitals, clinicians, and patients are meaningful users of health IT, and together the community achieves measurable improvements in healthcare quality, safety, efficiency, and population health. Today I'm joined by Jac Davies. She is the director of the Beacon community of the Inland Northwest. She led the development of the successful $15.7 million proposal to obtain federal funding for the creation of a regional care coordination project for individuals with diabetes. She currently manages the new program that was created, including developing project plans and overseeing implementation of those plans, and communicating and coordinating with federal and state agencies and with multiple private sector healthcare organizations, including hospitals, physician offices, insurers, pharmacies, laboratories, and long-term care organizations. Thank you so much for joining us today.
Glad to be here.
So our first question is, what do Beacons know about their local health departments and their activities?
Well, our Beacon, at least, is very knowledgeable about the local health departments. We cover over 13 local health departments in our Beacon geographic area, as well as 2 state health departments. We work primarily with, so far we've been working primarily with one of those, a large regional health department out of Spokane, Washington, and we're very knowledgeable about their work. Actually, the parent organization for our Beacon, Inland Northwest Health Services, has a program that's focused on community health efforts, and we've been working with the Spokane Regional Health District for many years on those, including tobacco cessation, increasing physical activity, and other areas. We believe the director of the local health department for Spokane is on our steering committee for our Beacon program, and we want to make sure that we are implementing it in a way that's going to support their activities.
And what do Beacons see as their current role in working with local health departments?
Frankly, our current role, our current emphasis is on pulling together clinical data. That's not to say that it's not an emphasis on working with local health, but the reality is our key role is going to be helping local health get better access to chronic disease information, especially for people with diabetes. And until we can get that information available for the clinical care side, we're not going to be able to provide it to local health. So that's really where we've been putting most of our effort. As we start developing this clinical data repository, then our intention is to start working with local health to make sure it's available for them for assessing their programs and planning interventions.
What seems to be working for them in their role with local health departments, and what seems to not be working with them in their role?
Well, it's the difficulty is, as your audience is acutely well aware, is resource limitations for the local health departments. And the reality is that for us to be able to share data with local health and for them to be able to utilize the data, they have to have the resources. Certainly they're very enthusiastic. They are our local experts in population health and in the diabetes population in particular. But for them to be able to take advantage of the new data sources that we're bringing to bear and the new capacity that we have as a region is really going to require them to either have more resources or realign some of what they're currently doing.
And anything that seems to be working well in this particular capacity?
There's a very strong awareness amongst the local health departments in our region about the opportunities that working with the clinical care system brings. They're very eager, they're very engaged. They actually have a very good relationship pre-Beacon with the healthcare organizations and the healthcare delivery system. And that in some ways has been helpful in getting the healthcare organizations to the table on our Beacon project because they see this as another community collaborative.
When was your Beacon project started? We
started in May of 2010.
And what do Beacons see as their potential role with the local health department?
Well, it's really on multiple levels, and people jump right away to surveillance, and certainly that's a big piece of it, the ability to have data from news sources, from ambulatory care, from pharmacy, from long-term care, to really help understand what's happening with the population. But beyond surveillance, we see that local health departments can really help guide some of the changes in how healthcare is delivered, as healthcare is moving more toward population health, and providers are having to focus more on delivering care based on outcomes, not just on numbers of services they provide. Then they're going to need some guidance on how those populations should be managed and what are the best practices for working with a population as well as population-based data on what impact is being had. And so local health really can help with that, and we think the Beacon projects are helping to build that bridge.
Finally, do you have any examples so far where you have seen a progression in your community as far as with the Beacon project?
We're still a little bit early. We have been spending the last year since May of 2010 on making a lot of decisions about what we were going to be doing, about implementing some technology, establishing the framework for the diabetes care coordination and quality measurement that we're implementing right now. So talk to me again in 6 months.
Jac Davies, thank you so much for joining us.
You're welcome. Thank you.
Thank you for listening to this edition of NACCHO's Beacon Communities Program podcast series. To download more podcasts, please visit our website at www.naccho.org.